Hello, I'm Dr. Kirk, here to break down Day 2 of Step 3 of the USMLE. Day 2 of Step 3 assesses your ability to apply medical knowledge and clinical skills in real-world scenarios. It tests your ability to manage patients over time, focusing on clinical decision-making and diagnostic reasoning. Think of it as a test of your ability to think like a real doctor, facing unpredictable scenarios and making crucial decisions. Step 3 presents unique challenges in its 2 days. Day 1 focuses on foundational medical concepts through multiple choice questions. Be sure to watch our other Step 3 video with detailed clinical explanations of the single best answer, multiple choice format. Day 2 dives into clinical case simulations, CCS, simulating real doctor experiences. You'll analyze patient history, physical exam findings, and lab results to develop a management plan. This day tests your clinical reasoning skills and ability to handle real-world medical practice complexities. Embrace the challenge and prepare diligently. On Day 2, for the clinical case simulations, start by taking a thorough patient history, understanding their symptoms, and asking relevant questions. Pay attention to details like onset, duration, and characteristics of symptoms. Inquire about past medical history, medications, allergies, and family history. Move on to the physical exam, noting vital signs and findings from various body systems. Familiarize yourself with the standardized format of physical exam findings. With patient history and physical exam done, it's time to order tests. Order relevant and high-yield tests based on your clinical suspicion. For example, a chest X-ray for suspected pneumonia. Interpret test results, correlating them with the patient's history and physical exam. Use the information to reassess your differential diagnosis and consider additional tests. The USMLE Step 3 tests your clinical reasoning skills through this process. Formulate a differential diagnosis based on gathered information. Prioritize conditions based on likelihood and potential severity. Consider the patient's age, medical history, and risk factors. Think critically and explore less common diagnoses if needed. Ground your thinking in available evidence and avoid jumping to conclusions. The goal is to guide your next steps in the diagnostic process. With a refined differential diagnosis, make crucial management decisions. Consider the severity of the condition, patient's health status, and treatment risks and benefits. Tailor your management plan to the individual patient. The CCS interface offers various management options, including medications and procedures. Justify your decisions based on evidence and established medical practices. The USMLE Step 3 assesses your ability to make rational decisions, prioritizing patient safety. Implement your management plan and monitor the patient's response. Order medications, schedule follow-ups, and admit the patient if necessary. Monitor symptoms and watch for adverse effects. Adjust the treatment plan based on the patient's progress. The USMLE Step 3 challenges you to adapt to changing circumstances. Demonstrate flexibility and sound clinical judgment. Recognize and manage complications that may arise during patient care. Analyze situations and decide on appropriate actions. Consider discontinuing medications, ordering tests, or consulting specialists. Complications can also arise from the underlying condition. Recognize patterns and anticipate potential complications. Timely intervention can mean the difference between positive and negative outcomes. Day 2 of Step 3 of the USMLE includes ethical considerations and communication. Encounter scenarios challenging your ethical decision-making. Respect patient autonomy and engage in empathetic communication. Communicate effectively with patients, families, and colleagues. Address patient concerns and obtain informed consent. Approach each case with empathy, integrity, and a commitment to ethical practice. Understanding computerized case management. Dive into computerized case management, or CCM. CCM simulates long-term patient management. It's about applying knowledge practically and making real-time decisions. Guide patients through illness, adjust treatments, and navigate unexpected turns. CCM cases are mini medical dramas on your screen. Make decisions about patient care as their condition evolves. Time is a factor. Simulating real clinical settings. Days, weeks, even months might pass within a single case. Adapt your approach as new challenges emerge. The CCM interface is your virtual clinic where you'll manage your patient's care. You'll see various sections, including the patient's history, physical exam findings, laboratory results, and a timeline. The timeline is the heart of the CCM case. You can advance the clock, simulating the passage of time and receiving updates on the patient's condition. Make decisions based on updated information, ordering tests, adjusting medications, or admitting the patient. Use all available resources, including medical references and drug databases. With each tick of the clock, the CCM case presents new challenges and decisions. Analyze the evolving clinical picture and choose from a range of interventions. These can include tests, medications, lifestyle changes, or procedures. Every decision has consequences, both positive and negative. Unnecessary tests waste resources and can harm the patient. Wrong medications can have adverse effects. Delaying crucial interventions can worsen conditions. The CCM cases assess your ability to prioritize patient safety, think outside the box, and consider a range of possibilities. Receive updates on the patient's condition, including test results and responses to treatment. Interpret these results accurately and adjust the treatment plan accordingly. Medicine is about constantly assessing and tailoring treatment to individual needs. Imagine you've prescribed medication for hypertension. Are the readings within the target range? Adjust dosage or consider other factors if not. Think critically about various factors and make adjustments. Unexpected findings may require reconsidering your diagnosis. Flexibility and adaptability are key. Effective communication is essential. Document interpretations, explain rationale, and address patient concerns. Time is of the essence in CCM cases. Make every minute count. Don't panic. Practice and effective strategies lead to confidence. Familiarize yourself with the interface. Navigate efficiently to save valuable minutes. Use resources comfortably under pressure. Focus on critical interventions first. Avoid unnecessary tests. Every action consumes time. Develop a systematic approach. Review history and physical exam findings. Analyze the timeline and test results. Formulate a differential diagnosis and prioritize. Reassess and adjust based on new information. Practice makes you comfortable with the format. Seek out practice questions and simulated exams. Preparation, practice, and a calm approach are key. Let's put our CCM knowledge into action with a case study. Meet Mr. Smith, a 55-year-old male with a persistent cough and shortness of breath. He's been experiencing these symptoms for about a week. Mr. Smith also has a low-grade fever and feels fatigued. He denies chest pain, but mentions tightness when coughing. His medical history includes well-controlled hypertension. He's a non-smoker with no known allergies. His vital signs show a slightly elevated temperature and respiratory rate. His oxygen saturation is slightly low, but he's breathing comfortably. You hear crackles in the lower lobes, suggesting fluid buildup. Differential diagnosis includes pneumonia, bronchitis, and possibly heart failure. A chest X-ray reveals patchy infiltrates, supporting pneumonia. You initiate treatment with oral antibiotics. Schedule a follow-up to monitor progress. Advise rest, hydration, and avoiding contact with others. This demonstrates the first steps in CCM: gathering information, formulating a differential diagnosis, and making initial management decisions. The clock ticks forward to day 2 of Mr. Smith's case. He returns for his follow-up appointment, reporting his cough has worsened, and he's experiencing increased shortness of breath. He's also developed a sharp pain in his right side, exacerbated by deep breaths. His vital signs show a higher fever and respiratory rate than previously recorded, and his oxygen saturation is lower, even with supplemental oxygen. Concerned by his deterioration, you order a repeat chest X-ray, which reveals a pleural effusion, a buildup of fluid in the space between the lungs and chest wall. This explains his worsening shortness of breath and the sharp, pleuritic chest pain. You suspect Mr. Smith might have developed a complication from his pneumonia, such as empyema, a collection of pus in the pleural space. To confirm the diagnosis, you perform a thoracentesis, a procedure to drain fluid from the pleural space. The fluid appears cloudy, suggesting the presence of infection. You send a sample for laboratory analysis, including gram stain, culture, and sensitivity testing, to identify the causative organism and guide antibiotic therapy. You also admit Mr. Smith to the hospital for intravenous antibiotics and closer monitoring. This part of the case highlights the importance of recognizing complications and adjusting the management plan accordingly. Mr. Smith's initial presentation suggested a mild case of pneumonia, but his condition deteriorated, requiring more aggressive interventions. Your ability to recognize the signs of complications, order appropriate tests, and modify the treatment plan based on new information is crucial for successful patient management in CCM cases. As days turn into weeks, in the CCM simulation, Mr. Smith's condition gradually improves with intravenous antibiotics and drainage of the pleural effusion. His fever resolves, his breathing improves, and the pleuritic chest pain subsides. The laboratory results from the pleural fluid culture reveal a bacterial infection sensitive to the antibiotics he's receiving. You continue to monitor his progress closely, adjusting his medications and treatment plan as needed. You also address his concerns and provide support throughout his recovery process. After a week of hospitalization, Mr. Smith's condition stabilizes, and you determine he's ready for discharge. Before he leaves the hospital, you provide him with detailed discharge instructions, including information about his medications, follow-up appointments, and warning signs to watch for. You emphasize the importance of completing his full course of antibiotics, even if he's feeling better, to prevent recurrence of the infection. You also schedule a follow-up appointment with his primary care physician to ensure continuity of care. This final stage of Mr. Smith's CCM case demonstrates the importance of long-term management and follow-up. Even after a patient is discharged from the hospital, their care doesn't end. You need to consider their ongoing needs, provide clear instructions, and ensure a smooth transition back to their regular healthcare routine. By addressing these aspects of patient care, you demonstrate your commitment to comprehensive and compassionate medical practice, a quality highly valued by the USMLE Step 3 examiners. Mrs. Jones, a 62-year-old with type 2 diabetes, arrives at the ER feeling weak, dizzy, and confused. Her heart is racing, and she's breathing rapidly. Vital signs show elevated heart rate and low blood pressure. Her blood glucose level is alarmingly high. These findings point towards diabetic ketoacidosis, or DKA. Treatment starts with IV fluids and insulin drip. Monitoring her vital signs and glucose levels is crucial to stabilize her condition. Mrs. Jones's journey with diabetes continues beyond her acute episode of diabetic ketoacidosis. Transitioning to long-term disease control, you address the complexities of chronic illness. Managing her diabetes requires medication optimization, lifestyle changes, and ongoing monitoring. Reviewing her medication history, you consider adjusting her diabetes medications. You discuss treatment options with Mrs. Jones, empowering her in her care decisions. Counseling on healthy eating, physical activity, and blood glucose monitoring is crucial. Providing educational resources and connecting her with a diabetes educator for support, monitoring her blood glucose levels, and adjusting medications as needed. A patient-centered approach empowers Mrs. Jones to manage her diabetes effectively. Empowering Mrs. Jones with knowledge and involving her in shared decision-making is crucial. Informed patients adhere to treatment plans and achieve better health outcomes. Explain medical concepts clearly using plain language. Encourage questions and active participation in care discussions. Provide educational resources tailored to her needs. Involve family members for a strong support system. Present risks and benefits clearly for informed decisions. Allow her to weigh pros and cons, aligning with her values. Emphasize open communication and a strong patient-physician relationship. Create a safe space for concerns and questions. Demonstrate empathy and commitment to her well-being. Highlight the role of communication and collaboration in patient-centered care. As we conclude our deep dive into Day 2 of the USMLE Step 3, let's recap the key takeaways. Remember, this day isn't about regurgitating facts. It's about proving you can apply your knowledge in dynamic, realistic scenarios. The clinical case simulations are designed to challenge you, to make you think like a doctor facing real patients with evolving conditions. First and foremost, mastering Day 2 requires a shift in mindset. Embrace the uncertainty. In real life, patients don't present with textbook cases, and test results don't always provide instant clarity. clinical case simulations mirror this reality, demanding flexibility and adaptability in your approach. Be prepared to adjust your differential diagnosis, reevaluate your treatment plan, and make decisions with limited information. Secondly, time management is paramount. The ticking clock in chronic care management cases simulates the urgency of real-world medical practice. Learn to prioritize tasks, focusing on the most critical interventions first. Don't be afraid to use the resources available within the interface, but do so strategically to avoid wasting precious time. Thirdly, never underestimate the power of communication. The USMLE Step 3 assesses not only your medical knowledge, but also your ability to communicate effectively with patients, families, and colleagues. Document your thought process clearly, explain your rationale for decisions, and address any concerns the patient might have. Remember, clear, compassionate communication is the cornerstone of patient-centered care. Preparation is key. Practice makes perfect. Familiarize yourself with the interface and timing. Master the art of the differential. Think like a clinician. Embrace the time crunch. Believe in yourself. You've got this.